Attention Deficit Hyperactivity Disorder, or ADHD, is a disorder characterized by persistent behavioral patterns of inattention, hyperactivity, and impulsivity that occur without forethought and have a high potential for harm. ADHD is understood as a genetically influenced and strongly heritable disorder, with approximately 70 to 80% of symptom variation explained by genetic factors, with families of affected individuals often sharing some clinical features of ADHD or having other members with the disorder. Buchanan and Henshaw describe it as a complex syndrome with substantial genetic influence that involves early departures from normal maturation of the prefrontal, subcortical, and cerebellar brain circuitry. Diagnostic criteria for ADHD requires onset by 12 years of age, although the disorder can affect both children and adults. ADHD can be diagnosed as early as 3 to 4 years of age, and diagnosing adults can be challenging since it is more difficult to obtain an accurate history. ADHD is present in about 8.5% of children and adolescents and around 4.4% of the adult population in the United States. Some CDC practitioner and parent surveys also suggest that there are steadily increasing rates of case identification for ADHD. ADHD, under different nomenclature, was first mentioned in the late 1700s and early 1800s. Medical literature in the early 20th century referenced children with ADHD using diagnostic terms such as minimal brain damage, hyperkinetic reaction of childhood, hyperkinesis, minimal brain dysfunction, attention deficit disorder, and ADHD. Between the 1930s and the 1950s, it was found that amphetamine-like stimulants seemingly calmed hyperkinetic children. By the 1960s, the FDA approved the use of the stimulant Ritalin for treating symptoms of hyperactivity. The diagnostic criteria for ADHD has been continuously refined and changed over the years as more adults and children are being diagnosed, leading to an understanding of ADHD as a non-unitary syndrome that has multiple different presentations in both children and adults. In order for an individual to be diagnosed with ADHD, as outlined by the DSM-5, they must A. show a persistent pattern of inattention and/or hyperactivity impulsivity that interferes with functioning or development. B. Several inattentive or hyperactive impulsive symptoms were present prior to 12 years of age. C. Several inattentive or hyperactive impulsive symptoms are present in 2 or more settings, such as at home, school, or work. D. There is clear evidence that the symptoms interfere with or reduce the quality of social, academic, or occupational functioning. E. The symptoms do not occur exclusively during the course of schizophrenia or other psychotic disorders and are not better explained by other mental disorders. At least 6 of the following symptoms of inattention must be present for at least 6 months and to a degree that is inconsistent with normal developmental levels and negatively impact the individual's functioning. A. Often fails to give close attention to details or makes careless mistakes in schoolwork, at work, or during other activities. B. Often has difficulty sustaining attention in tasks or play activities. C. Often does not seem to listen when spoken to directly. D. Often does not follow through on instructions and fails to finish schoolwork, chores, or duties in the workplace. E. Often has difficulty organizing tasks and activities. F. Often avoids, dislikes, or is reluctant to engage in tasks that require sustained mental effort. G. Often loses things necessary for tasks or activities. H. Is often easily distracted by extraneous stimuli, and I. Is often forgetful in daily activities. At least 6 of the following symptoms of hyperactivity and impulsivity must be present for at least 6 months and to a degree that is inconsistent with normal developmental levels and negatively impact the individual's functioning. 5 symptoms may be present for individuals ages 17 and older. A. Often fidgets with or taps hands or feet or squirms in seat. B. Often leaves seat in situations when remaining seated is expected. C. Often runs about or climbs in situations where it is inappropriate. In adults, this may manifest as restlessness. D. Often unable to play or engage in leisure activities quietly. E is often on the go, acting as if, quote-unquote, driven by a motor. F often talks excessively. G often blurts out an answer before a question has been completed. H often has difficulty waiting his or her turn. And I often interrupts or intrudes on others. ADHD is viewed by Buchanan-Hinshaw as a neurodevelopmental syndrome affected by multiple developmental pathways and causal processes. A percentage of individuals with ADHD are found to have been affected by early neural injury due to prenatal substance and/or toxin exposure. Another percentage may represent extreme temperaments interacting with a society with a tight conformity to indoor desk-type work in childhood. And another percentage may show the interaction between genetic vulnerability to ADHD and environmental risk factors, which is a major concern for researchers. While it is believed that multiple mechanisms could contribute to the development of ADHD, it is thought that the primary internal mechanism contributing to ADHD involves various kinds of breakdown in the striatal prefrontal neural circuitry supporting cognitive control. Barkley brings up an interesting understanding of ADHD by integrating it into a larger web of understanding with commonly occurring comorbid disorders, such as emotional dysregulation, or ED, and oppositional defiant disorder, ODD. He states that the ED component seen in ADHD is likely involved in the origins of ODD through its emotional and social components. Barkley further goes on to say that research has shown a decrease in comorbid ODD symptoms when ADHD symptoms are reduced with certain medications, suggesting that ADHD is a causal factor contributing to the origin and maintenance of ODD. Barkley shows the importance of viewing a mental disorder in a non-reductive manner for the proper treatment and reduction of its symptoms. This more holistic understanding sheds light on the complexity as well as the gravity of ADHD and other mental disorders.